Aloha gang, Dr.Russ Rosen here. Welcome to the OHC Community Facebook group. And we are live right now. And today we're going to be talking about how to handle difficult patients, difficult questions, and difficult situations. And I'm going to go ahead and check to make sure that is actually showing that we're live. So I'm going to re-click on that and see if we're actually showing live, because there's always that delay. Good. So we're live. Good. You can go ahead and let me know if you're here and also where you're from. I always appreciate knowing that. If you have any questions along the way, go ahead and type those out. When I'm done going through my wrap, I'll come back and answer any and all questions. Obviously, if you're watching this later on, go ahead and post any questions. I'll answer those for you. My goal is to help you thrive in a care versus scare true optimal health model. In other words, if you want to help people get healthy and stay healthy for a lifetime versus just helping them out of pain, masking their symptoms, etc., I can help you do that. Okay, so today specifically what we're going to be talking about is how to handle difficult situations. And look, we all want to have a great experience in practice. We want to have fun. We don't want to feel stressed. We don't want to have uncomfortable situations. But the reality is, they happen. It's just what happens. The question isn't, will they happen? The question, of course, is, how will you handle it? Quite often we find ourselves dealing with these difficult questions and patients and situations, and we don't handle them the right way. We don't handle them the best way possible, and we end up regretting it. Oftentimes we ruin the relationship, or we don't say what we wish we would have said, and then we replay it in our head for the next 3 days, etc., etc. So, just think about, like, have you had a situation where a patient asked you a question or they made a comment that you just didn't quite know how to handle? Have you ever been in one of these conversations and recognized that it ruined the relationship, the way that it was handled, and that you regretted it? Or again, that you just simply didn't say what you wish you would have said, and then, you replayed it in your head for over and over and over again for days. Have you ever heard staff say something and it was like nails on a chalkboard? You cringed. This is all about how do we handle that. So I'm going to give you some templates. Step 1, all of my communications are based on the neuroscience of communications, and foundationally is on this laser process. LAASR. Listen, acknowledge, ask, solution, resolution. So why do we listen? Well, we listen so we know, so they know that we know, and so that they feel heard. Obviously, there's a lot to this, but I'm giving us a short version. Acknowledge. Why do we acknowledge? So they feel heard. If we don't acknowledge, oftentimes they'll just keep going over the same thing over and over and over again. If you've been chewing on the bone with your sweetheart, or with your kids, you guys are actively arguing. If someone keeps bringing something up over and over and over again, they just don't feel that you've heard it, right? So really important that they feel heard, but it also de-escalates the situation. We need to, if it's a charged situation, and oftentimes they are, we need to de-escalate it, and simply acknowledging it. A really powerful one is to thank someone. Well, thank you so much for bringing that up. I appreciate that. It just de-escalates the situation. How do you get angry with that? We then ask. So listen, acknowledge, ask. And we ask clarifying questions. What we're trying to do is we're trying to clarify and differentiate this between this. We're trying to find out, why are they asking this question? What is the truth? What do we really need to find out? So we're asking clarifying questions. And in the neuroscience of communications, if you were watching that one, we talked about asking Socratic questions. So I don't want to ask a lot of yes and no questions unless they're appropriate. But I want to ask a Socratic question, one that makes him think: who, what, why, where, when, how, that makes him go, arr, They want to think about it. That brings it up past the reptilian brain and the neocortex for thinking, reasoning, and problem solving, so it can drop into the limbic system as a new belief system. Once we've done that, we then want to help find a solution. And once we've found a solution, we want to find a resolution. Now, a resolution is something that we're both happy with. So, I want you to come in 3 times a week and stay at 3 times a week. Well, they don't want to, but they're not a driver, so they're not real confrontational. So they're not going to say anything about it. They're just not going to come back. So a solution is anything that would solve the problem. A resolution is something we both feel really good about. So we're going to be using that. Now, I want to share with you my formula for using laser the first time, well, when we are with a patient that is having a difficult situation or question or comment, etc. So this is what we're going to do. We're going to start with a temperature reading. So my doctor says that I should stop seeing you and go see a real doctor. What's your temperature reading? Are you pissed off? My experience is, me being a driver, I rarely win. I rarely do well when I'm angry. I almost always blow it. So you always want to do a temperature reading. Now, obviously, I have a 32. I have 32 of the most common questions, concerns, comments, challenges that happen. And I take you through the entire process of all of these. How do I use listen, acknowledge, ask, solution, resolution, as well as this particular template? So you can think them through. And once you've thought through those 32, you don't get caught back on your heels. I'll be actually sending that out to you if you're in the club. So if you want to get that, just go ahead and put club below, and I'll send you a link. You can jump in there for free. Thursday at 11 o'clock, I'll be discussing this in Zoom with doctors, helping find your most challenging situations and applying this to those, so you really see how to think it through, and I'll send you those 32. But step 1, temperature reading. If you're pissed off, breathe. Don't engage in this conversation. Take a moment. I got to go grab something. I'll be right back, whatever. Then you want to look at the classic blunder. Now, there's a lot of different classic blunders, but we have assertives and we have non-assertives. So the assertives usually get angry. They render themselves offensive. The non-assertives usually join what I call the okay corral. They just say, oh, okay. Whereas the assertive driver, they never back down, but they ruin relationships. So implied message. What is the implied message? Hey, could you just adjust my low back today? Well, what could the implied message be? It could be because you hurt my neck last time. It could be because my low back really hurts a lot today. And the truth is, you won't know till you ask. And I do have a crystal ball right over there, about that big, real beautiful one. It just didn't come with instructions. And I know that with my wife, who I love dearly, I'm wrong more than 50% of the time when I'm trying to crystal ball and mind read her. So, best thing to do is just ask. Okay, then you want to ask yourself, well, what is your truth? So what is it that you actually want to say to the person? Just think about what it is you want to say. Sure, I'm happy to just adjust your low back today. Or, well, we would need to do an evaluation. Or if I did hurt you last time, we would need to use laser, listen, acknowledge, ask, solution, resolution, to be able to handle that. Again, that's one of the things I have in that 32 document. So here's some classic issues and classic blunders. Yeah, you know what, Doc, I gotta tell you, it's just too expensive. Here's a classic assertive. Are you kidding me? You can't afford not to get care. If you don't get care, here's what's coming. How much is a night in the hospital? I literally spit. That's what we assertives do. I've done that. The non-assertives go, oh, Okay, well, I'm sorry. And then oftentimes they'll make it a cheaper price for them, or they'll just, okay, well, I guess you can't do it then. Right? Neither of those work. Neither of those work. We want to have thought this stuff through. Yeah, God, Doc, I got to tell you, I don't have time. Assertives, you don't. Same thing. You don't make the time now. You're just going to happen. You're going to have the time later, right? And then non-assertives, same thing. Okay, corral. Um, Doc, I don't think that this is working. Um, what are you talking about? It's not working. Look at this. Look how this changed. Blah, blah, blah. Classic assertive, non assertive. Oh, I'm so sorry. Instead of clarifying, acknowledging, right? Oh, gosh, I'm so sorry that you're feeling that. Let me ask a question. Ask a clarifying question to find out why they're saying that, what the truth is. Yeah, because my elbow still hurts. Well, what about your 30 years of daily migraines? Oh my God, they're gone. I forgot all about those. Right? But if you don't ask a clarifying question, you'll never be able to find a solution and resolution. Um, you know what, Doc? On this scale, I think I'm really healthy. -10 is near death. 0 is comfort. I feel good, but I'm not functioning at my optimum. I'm not healthy. And +10 is I'm as healthy as I could possibly be. So where do you think you're at? Oh, I think I'm a +9. Well, they're in excruciating pain. They're sick. They're 400 pounds overweight. Clearly, they're not a +9. Here's a classic blunder of an assertive. Are you kidding me, you fat shit? That would be a beautiful classic blunder. A classic blunder of a non-assertive would be to just go, oh, okay, well, if that's where you think you're at. No, no, we need to acknowledge, right? Listen, acknowledge, ask clarifying questions. So on this chart, 0 means you're comfortable. You're not having lots of aches and pains, but you're miserable. On this chart, you're as healthy as you could possibly be, but you're carrying some extra weight. So, we need to clarify the truth, right? We can't just let them say what they want to say, or how often do you think you should be coming in? Once every 2 weeks. Well, I think they need to be here 3 times a week right now. Am I going to just say, okay? No. I'm going to help them clarify what that would buy them. So 3 times a week, we can probably get to here. Every other week, I don't think we're going to gain any ground, right? So we really want to think this stuff through. Yeah, you heard me last time. Classic blunder of an assertive. No, I didn't. That was just the adjustment that needed to happen. It was a great adjustment. Really? Non-assertive. Oh, I'm so sorry. Let me pay for your next 10 visits. Blah, blah, blah. Okay. One of my favorite phrases is, it's a great question. Why do you ask? Doc, could these adjustments be causing me to feel lightheaded or dizzy? Yeah. They definitely could. Drag, my uncle, who's a neurologist, told me you chiropractors stroke people out, and I'm probably, going to stroke because are you glad you said yes? No. Or no, I don't think it could cause you to get lightheaded or dizzy. Too bad, because when I get adjusted, I feel this life force come flowing through me, and I connect to the Akashic records of all of time, and I feel spirit flowing through me, and I feel a little bit lightheaded. Right? Are you glad you said no? No. So find out, what do they mean? Just, great question. Why do you ask? Okay. So those are the basic formats. Now, Thursday at 11, if you can make it, please make it in there. We have a discussion. I'll discuss your favorite challenges, and we'll bring them to life for you. If not, I do put the recording in the club. If you want those, go ahead and put club below. I'll give you access to our club for an entire month for free. And then we'll be going through, and I'll be sending that document. So let me go ahead and check and see if anybody put that they're there. Susan Colley. Aloha, Susan. Good to see you, sister. And I'm going to be back home. I am so excited. I'm going to be back home in Maui 23rd of December. So I'm so excited about that. Okay. And no one else here right now. Any questions? No other questions. So if you're watching the recording, you have any questions, let me know. If you're interested, please share this with other people if you found any value. If you're interested in getting the 32 questions or statements and this and this, and the marketing, all the stuff that we do in the club, just put club below and I'll send you a free month. Hope that helps. Hope you found value. As always, much love and aloha.